Stoltzfus, and the class that this lecture is for is Psychology 412, Clinical Psychology. And today we're going to be talking about the clinical psychology treatment process. The first question we need to think about when we talk about the clinical psychology treatment process is, why do we need a process? And a lot of people who end up in clinical psychology are the kinds of people that have had friends and relatives say, you're just an easy person to talk to. And so a lot of us just kind of feel like we naturally come to helping people, to listening to people, to counseling people. But the truth is that the clinical psychology treatment process, it gives us sort of a roadmap or sort of a blueprint to follow when we're helping people. And that's one of the differences between professional and non-professional helping. So I kind of joke with people sometimes that, some people go and talk to their grandma when they're feeling upset or sad. And the difference between a clinical psychologist and your grandma is that a clinical psychologist has a process that they follow, a process that they engage in. And while what they talk about and what they do with each person is going to be different, that process is going to be pretty similar from person to person. And that process harkens back to their training and to the knowledge that they received through their education and their on-the-job training as well. And so having this clinical psychology treatment process helps professionals to have some degree of uniformity regarding what we should do and when we should do it. And so we sort of know how to work with people because we have a general process that we follow. So I want to talk just a little bit about what this process looks like. And I should say that people conceptualize this process differently. So I've seen it have 7 or 8 steps. I've seen it kind of talked about different ways. But this is the way that I think makes most sense, at least based on my experience. And I think it's a good way to at least start off thinking about what a clinical psychologist do and how do they do it. So the first step in the clinical psychology treatment process is assessment. So someone comes to see us for professional help for clinical psychology services, and the first thing we have to do is assess what's going on with this person. What do they need? And oftentimes what we're trying to do is figure out, does this person have a diagnosis or not? Is there something going on with them that meets the criteria for a DSM-5 diagnosis? And that might be something like major depressive disorder or generalized anxiety disorder or oppositional defiant disorder. And so we've got to figure out, is this sort of normal functioning? Everyone feels sad sometimes, everyone grieves sometimes, or is this pathological? Is this a pathological issue? Is this sadness that is affecting day-to-day life and performance of obligations like school or work or family obligations? And then we're starting to look at, this might be a diagnosable condition. So that's what we're doing with assessment. We're trying to get to know the person and specifically figure out what's going on with them, what is the problem, what's the real thing that we need to be focusing on with them. The second step in the process is treatment planning. So once we've agreed with the client, and the client's always involved in this process, the client gets to say in why they're there, what their assessment is, what their problem is, and then they also get a strong voice in the treatment planning process. And so with treatment planning, we're trying to figure out, now that we know what's going on with the client, what can we do to help them with it? And so there's kind of an art and a science to writing these treatment plans, and we'll talk more about that when we get to that point in the course. But right now, what you need to know about a treatment plan is that it's a plan that's agreed upon between the clinical psychologist and the client to resolve the issues that have been identified during the assessment. Sometimes we call those issues the presenting problems. The third step of the process is intervention, and this intervention stage just involves implementing the treatment plans. We've had the treatment plan, we've figured out what we need to do, and now we're going to go ahead and do it. And in this intervention stage, one of the things we're going to talk about when we get to this section of the course is how the therapist uses him or herself as a tool in the intervention. So how we relate to the client, our intervention, our personal style and relationship with the client, that all kind of plays into this intervention stage. So after we've assessed the client, come up with the treatment plan, started doing the interventions, then periodically we have to evaluate whether what we're doing with the client is helpful or not. Is the client improving? Is the client getting better? And there's a couple different ways we can do that. We'll talk more about that when we get to that part of the course. But right now what you need to know is this evaluation is a periodic review of whether our services or interventions are being effective or not. And then finally, the last stage in the process is termination. When the client has achieved their treatment goals, when our evaluation shows that they've improved to a point where they're functioning in a more healthy way, then we end the services. And so one of the things we'll talk about when we talk about termination is the fact that we need to always let our clients know from the very beginning that we're going to have a unique sort of professional relationship with them. This isn't going to be a lifelong friendship. This is going to be a time-limited relationship. This is going to be a situation where we're working together for 6 months or maybe even a year, but at some point it's going to end because it's a professional relationship. It's not a personal relationship. One other thing I wanted to mention in regard to the clinical psychology treatment process is the fact that this process is both linear, but it's also nonlinear. So when I say it's linear, what I mean is that we go in order. So we start with the assessment, we do the treatment plan, we do the intervention, the evaluation, then termination. But it's also nonlinear because we're always assessing, we're always planning, we're always intervening, we're always evaluating. Here's what I mean by that. So when we're working with a client, when we're doing the assessment, there are ways that we can assess that also involve intervention, right? When I'm talking to somebody, I worked a lot with people with substance abuse issues, and so when I'd be talking with them about their drinking or their drug use, I'd already be trying to lay the groundwork for how this is causing a problem in their life, and that would be something that we'd pick up on in the treatment planning stage, and it sort of served as an intervention, right? I'm raising their awareness that drinking is causing problems. It's making them argue with their wife. It's led their boss to fire them. It's gotten them in trouble with the police. That's a little bit of an intervention itself. So these stages, while we do them one by one and in order, they're also kind of mixed up together because we're always assessing. And while I'm assessing, I'm planning. I'm thinking, what do I need to do with this person? And while I'm doing my counseling sessions, while I'm in the intervention stage, I'm also planning. I'm thinking, what do I need to do next time? What else does the client need besides what we're doing? I'm always evaluating after each session, is what I'm doing with my client working or not? So hopefully you understand that it's both linear and nonlinear. And also, I wanted to mention that sometimes we have to go back and redo a step in the process. So let's say that we've done the assessment, we've done the treatment plan, we're doing the intervention, and all of a sudden the client mentions that they are feeling very depressed. And maybe we've been working on anxiety, and all of a sudden we find out the client's depressed too. We need to go back and do another treatment plan, and we need to add interventions in, and we need to evaluate whether those are working. And so we kind of jump around in that process. We don't go just step by step, but it's a fluid process that goes in order, but it also is mixed up together, and sometimes we have to go back and repeat steps. So hopefully that makes sense. This is a short video lecture, but just wanted to get you sort of acquainted with the clinical psychology treatment process and the nature of that process. Thanks a lot. I hope you're having a good week, and I'll talk to you next week. Bye.